It's very exciting, and we're very lucky to be able to work together as a breast reconstructive and breast surgical team. I happened to be the one who landed here at Hendricks first and was lucky enough to be able to be on the team that recruited both Drs. Bowling and Dr. Mattingly.
A patient that comes to be taken care of at Hendricks Regional Health can expect that they will be well taken care of. What they will get is a compassionate team of people that will take care of them from a team approach.
1 in 8 women will face breast cancer in her life. So if through routine screening we can catch that cancer a year early and prevent any sort of profound outcome in her life, then that's a victory for us in imaging. Now with the 3D mammogram, if we do see a finding there, we're more confident in that finding that we can direct that woman to go directly toward ultrasound opposed to doing more mammogram views. So if a woman does get called back from a screening mammogram, first with our 3D mammogram, that decreases our likelihood of us having what we call a false positive. So that decreases her anxiety in that part. If there is a true finding there, then typically we are able to work that up completely and perform a biopsy that same day.
When our patients come in for a high-risk visit, we talk to them about genetic testing. It is a simple blood draw that they get. It tests for 28 different genes.
You put the patient at the center of the care and you build all these resources around them. So the patient is here, and how can we all as a team work with them and be the village that gets them through this journey. I'm usually the first person that a patient meets when they are diagnosed with breast cancer, and we talk about breast cancer in general, the diagnosis, the different types of treatment that we use for breast cancer, and then I talk about specifically the role of surgery with breast cancer.
Usually at the first appointment with a patient, we will discuss their diagnosis. The first priority for me is to focus on what their needs are. We also like to discuss anything that might impact their ability to get care in a timely fashion.
Here at Hendricks, we are now developing our Survivorship program, which encompasses the patient after they've completed their active treatment. What that means is, what does your life look like? You are going to survive your cancer, and how do we take care of you after that? People hear that they're diagnosed with a breast cancer, they're diagnosed with any cancer, and all life stops.
We want to make sure that they're not stressed out about having recurrent cancer. Maybe we need to refer them to a physical therapist because they're having effects of chemotherapy where they're, have some neuropathy in their legs.
So the survivorship team makes sure that you start to take care of the whole person and not just the organ that's affected with cancer.
And we're trying to increase their quality of life.
I grew up in Plainfield and basically providing care now to this community. I do feel a great sense of fulfillment and connection to this community.
You still get a small town feel of a hospital, but advanced medical care at the same time, and you can't get that everywhere. There's still a very high-touch, hands-on approach for everyone that is in this hospital.
I felt most at home here.
Hendricks was actually a great fit for me because growing up, this was our hospital to come to.
It is with all of the newest things that we are starting to do here at the hospital that I'm really excited to be able to take care of the western half of the state of Indiana, but also central Indiana too.